Heart disease, it is the leading cause of death in the U.S. and that's why doctors say knowing your risks to prevent a heart attack, it's crucial. WFMY News 2's Sydney Moore spoke with one Greensboro man whose family history increased his risk.
In November of 2022,
I felt very tired.
Mac Cheek was sound asleep in his bed.
It was 3 in the morning.
When suddenly a heart attack woke him up, forcing his wife to call 911.
They told my wife to get me to chew some aspirin, and then she called my daughter, who is a PA in the emergency room here.
Cheek was 65 years old at the time. He spent a total of 17 days at Cone Health's Heart and Vascular Center.
Luckily for us, 3 of the top cardiologists in the universe were here.
While the care was top-notch, Cheek spent the first 7 days in a coma.
I can remember crazy things that never happened. I told everybody my dog was in the room across the street, across the room, hall, wanting to come in here and be with me.
The big question, how did this happen? Cheek says he has a family history of heart attacks.
My father died of a heart attack very young, 54.
He says he didn't know the importance of knowing your family history and taking a heart scan until it was too late.
The results said I was 99.9% sure to have a heart attack in the next year. And it happened in 10 days.
Dr. Manish Patwardhan is a cardiologist with Cone Health. He says on top of knowing your family history, there are other factors that can make you vulnerable to a heart attack.
Your blood pressure, cholesterol, smoking, lifestyle, exercise or lack thereof, diet.
He says age 50 is when at-risk groups can start seeing symptoms. The older a person is, the more at risk they are.
It could be chest heaviness, chest tightness, fullness, could be radiating to the jaw, sometimes associated with shortness of breath. These are the common symptoms.
After spending 17 days in the hospital,
I'd lost about 20 pounds just in that short a time.
Doctors advised Cheek to get put on medication, eat healthy, and exercise.
Yeah, because I always think that work is number one, and it ain't.
2 years later, he says he feels like $1 million.
I feel really good.
He's thankful for doctors at Cone Health who made him feel like family.
They took care of me like I was their own child.
A little TLC truly does go a long way. In Guilford County, Sydney Moore, WFMY News 2.
So as we just heard, knowing the signs of a heart attack and acting fast can save a life. And so we're hearing again from Dr. Manish Patwardhan with the Cone Health HeartCare, here to help us stay heart smart. To start with, let's just talk about those key signs of a heart attack that we should all know.
Absolutely. Thank you so much for having me on your show, Tanya. Heart disease is #1 killer in the United States, and it's very important for us to recognize those symptoms of heart attack. To remember, any chest pain, chest fullness, tightness, squeezing sensation may be associated with any dizziness or vomiting or shortness of breath. If any of these symptoms come on and last for more than 10 to 15 minutes, you should consider them very, very alarming for heart attack. Now, some patients of mine have said they had shortness of breath or uneasiness, not typical chest pain, but any of these symptoms occurring anywhere in upper part of your body, it could be radiating to jaw, radiating to arm, you should take them very, very seriously.
Yeah, don't just like pass it off. Really pay attention to how long it's lasting and make sure that someone's around with you to call somebody. So what are some signs that people are commonly ignore, or maybe they misinterpret as something else that maybe they really shouldn't?
Yeah, absolutely. I'm very glad you asked that question. You know, some of my patients have told me they had indigestion symptoms. That's a very common symptom that patients misinterpret, especially holiday time. We're all indulging in some delicious food. Indigestion is a very common symptom that patients misattribute to. And you should, if you've not had any previous history of acid reflux, and you have these sort of indigestion-like symptoms lasting for more than 15 minutes, and again, I said shortness of breath. Diabetic patients and women often have atypical symptoms of heart attack. So any shortness of breath, indigestion lasting for more than 15 minutes, don't take it lightly.
Okay, so let's just kind of put it out there for everyone. How dangerous is it to wait and see if the symptoms are just going to pass?
Very important to know that time is muscle, as we call it in these situations. From the time your artery is blocked and causing a heart attack, the time is really ticking. For that time period when your heart muscle is not receiving blood flow, every minute counts. And the sooner you present to the hospital and sooner we get to open that blocked artery, it can really make a difference between life and death. So time is muscle. Don't waste time. If your symptoms last for 10, 15 minutes, go ahead and take them seriously.
Okay, so there are definitely people at home that are like, well, I haven't had any of those kinds of symptoms or anything, and I'll get it checked out at some point in time. I don't, it's too busy right now. What would you tell them?
I get it. It's holiday time. Everybody's busy getting ready for the holidays. But, keep in mind, any heart attack can be life-threatening. Holidays will come again next year, but if it is a heart attack, you don't want to take it lightly.
So when you say you need to do something, if someone has those symptoms that you talked about, what should they do?
It is very important to pick up the phone and call 911 immediately when you are having these symptoms. Sometimes I've had patients who said their family would drive them to the hospital or they would drive themselves. It's important to keep in mind when heart attack is happening, it can lead to complications which could be life-threatening. And in those situations, it is not recommended for you to drive yourself or your family members to drive you. It is important you call 911 and have the EMS come and evaluate you and take you to the hospital. They are equipped to handle any emergency situations that can arise in the setting of heart attack. So it is very important that you call 911 and let the EMS take on from there.
All right, so this time of year, though, does bring changes in our normal routines. So what recommendations do you have to sticking to like a heart-healthy diet during the holidays? Because that's a tough one.
That is a tough one. And we all are getting together, celebrating holidays with our family, friends. And it is easy to forget about those heart-healthy diet tips. But few things I always recommend my patients, it's not just what you do around the holidays, but what you're doing the entire year to stay heart-healthy, that what counts. When it comes to holiday meals, few tips I give my patients, go eat your salads and your appetizers. And when you're feeling full, when you get to main course, maybe you're eating less of those calories. Also important for patients with hypertension or congestive heart failure, it's important to remember to go easy on any added salt that can trigger increase in blood pressure or worsening of heart failure. And also important thing to keep in mind is after you've had your meal, go out and take a walk. If it's cold, bundle up and make it a family activity. Go for a 10, 15 minutes walk, get a few hundred steps in, and all that counts and really can get your digestion going, and your heart healthy diet and lifestyle rest of the year is really going to keep you in good shape when it comes to holidays.
Well, you kind of touched on it a little bit. I was about to ask you about exercise during the holidays. I like the after dinner walk. Is there something else that we can do?
It's important to stay consistent. Holidays or not, take up an activity that is sustainable. It could be just as simple as a 20-minute walk. We tell patients and everybody to walk as much as possible, 10,000 steps most days of the week. And sure, you may not hit those 10,000 steps when it's holiday weekend, but just make it a point to make it a habit to go out and take a walk. And once it's part of your daily routine, holidays or not, you're going to do it and you won't regret it.
Because it'll make you feel good besides. Okay. Now, stress can certainly spike this time of year. How does stress impact heart health and how do we manage it best?
It's very important. Stress can be a risk factor for several heart-related conditions. It could be high blood pressure. Also, if you have any underlying coronary artery disease, you're more likely to have angina or chest pain symptoms if you have ongoing stress. There is also a relatively rare condition called stress-induced cardiomyopathy, which is triggered all by stress or any emotional triggers. So it is important to manage your stress, especially going into holidays. We are all worried about, gift buying and getting ready for holidays, but just find an activity, whether it's exercise or meditation, that will help you cope with your stress going into this time of the year.
Okay, so we talked about eating, we talked about stress, and exercise. What other steps maybe should we take to protect our hearts, both now but really year-round?
It's very important to recognize the risk factors for heart disease. And I start with no smoking. If one thing you remember from today's discussion, no smoking. If you're smoking, try your hardest to quit smoking. I know it is very difficult, but that is number one reversible risk factor for heart disease. Also, making sure you're staying heart healthy with your diet and lifestyle, and also controlling your risk factors like hypertension, diabetes, high cholesterol, making sure you're seeing your doctors regularly in order to control these risk factors. And all these things can go a long way in preventing heart disease in first place.
Well, let me ask you this, because a lot of times we kind of fall off our regimen of what we're taking. How important is it keeping up with the schedule of our heart medications?
I tell my patients often, set an alarm. It gets busy during the holidays and you can forget about taking your medications. Set an alarm to take your medications on time. Make sure you're keeping up with your doctor's appointments. It can get busy during the last part of the year. Make your doctor appointments earlier in the year if it's possible. And just don't skip your regular follow-ups and maintenance doctor visits, and make sure you're taking your medications as you should on time.
Okay, 30 seconds. Once again, just go down the signs and symptoms of heart attack.
Absolutely. Chest pain, chest heaviness, tightness, radiating to jaw, neck, arm, shortness of breath, could be associated with dizziness, vomiting. Women can have unusual symptoms, so can be diabetic patients with complaints of shortness of breath more than chest pain. It's very important if these symptoms last for more than 10 to 15 minutes or go away and keep coming back, take them very seriously.
Call 911. Do not wait. Okay, that's what I heard.
Absolutely.
Thank you so much for your care and your expertise. If you need any of this, this will be in our 2-year well-being section of our website.